we're so excited that the ADAURA study was presented at ESMO with a paper coming out of the New England Journal of Medicine. And Dr. Subai, on behalf of all the authors, presented an update of the data, showing, as we saw at FASCO, that for the primary endpoint, patients with stage 2 and 3 disease who have completely resected tumors, the adjuvant osimertinib had a hazard ratio of 0.17. And then in the secondary population, adding back the stage 1B patients, actually the hazard ratio was even lower this time, 0.20. So even with more follow-up, the results continue to hold 80+% improvement in disease-free survival. Other things that were shown at the meeting were the local, regional, and metastatic sites of recurrence. And one thing that was quite impressive was recurrence in the brain. At the time, at the 2 years, 98% of patients who had osimertinib were disease-free in the brain, whereas only about 85% of patients on the placebo arm were free of brain metastases. So a hazard ratio of 0.18. So a 92% improvement in preventing recurrence to the brain. I think that this is another nail in the top of this data set. It really shows that not only do we improve disease-free survival, but we also improve morbidity because we keep patients from developing metastases in such sensitive sites as the brain. And this is very important. And right now, the ADAURA study will continue on to look at the other important secondary endpoints, including survival. That's ongoing right now. Patients remain blinded at the level of their drug. So we have many patients still on study. So we're following those data, and it'll be interesting to see that in the future. But in the meantime, the disease-free survival being so dramatic, along with the improvement in such difficult to treat areas such as the brain, I think speaks that this is practice. These are practice-changing data. And additionally, we've collected samples of blood, and we're going to be able to look at cell-free DNA and better understand mechanisms of resistance as well. So very, very compelling data, and it's great that we were able to present it again at another wonderful virtual meeting, the ESMO virtual meeting.